Hello, and welcome to the 2020 PEBB Program Annual Open Enrollment Presentation for Retirees. Your retiree insurance coverage is provided by the Public Employees Benefits Board, or PEBB program. It is administered by the Healthcare Authority. The retiree benefits package offers you comprehensive insurance coverage, which includes medical, dental, and auto and home insurance, as well as retiree term life insurance. Understand that's only for eligible retirees who participated in PEBB or SEB employee life insurance. Annual open enrollment this year is from November 1st to the 30th of 2019. In support of open enrollment, the PEBB program offers statewide benefit fairs, which run from October 29th through November 15th of 2019. There will be 17 fairs statewide. There will be retiree presentations, just like this one, at 15 locations. To find the dates, times, and locations of the fairs and the presentations, please see the October For-Your Benefit newsletter, or you can go online at hca.wa.gov/PEBB-fairs. Do understand that PEBB and Medicare have different open enrollment periods. The Medicare open enrollment period is from October 15th through December 7th. As a reminder, the PEBB open enrollment period is from November 1st to the 30th. To find more information about annual open enrollment, again, read your October For-Your Benefit newsletter that you received in the mail or in email. You can visit the PEBB website at hca.wa.gov/PEBB-retirees. And of course, you can speak with PEBB program and plan representatives at the benefit fairs. So in October, the PEBB program would have mailed retirees the following: that For-Your Benefit newsletter we've been talking about, as well as a customized letter specific to you, which contains the following: your current enrollment and current premium amount, along with what next year's premium amount will be. In addition, we list what other available health plan options are for you and those premium amounts for those plans. So that is a great resource for you to have, and we have a lot of people who bring those letters to the fairs so they can discuss that with their providers. So what is it that people can do during annual open enrollment? You can change your medical and/or dental plan. You can defer or terminate your and your dependents' health plan enrollment. You can enroll or remove dependents. Do note that if you're adding a dependent, proof of your dependent's eligibility may be required, and you can go to the PEBB website to find a list of valid dependent verification documents. The web address is listed on the screen. If you have previously deferred your PEBB coverage, meaning you're not on it right now, but you told the program that you wanted to defer, you can enroll in PEBB retiree health plans by providing proof of continuous enrollment in one or more of the following qualifying coverages. Those would include employer-based group medical, which could be which you may have had as an employee or a dependent of an employee, a federal retiree plan, such as a TRICARE plan, the Civilian Health and Medical Program of the Department of Veterans Affairs, or known as CHAP VA. If you enrolled in Medicare Parts A and B and a Medicaid program that provides creditable coverage, and lastly, the Health Benefit Exchange. Do understand that the Health Benefit Exchange is not available for people who are eligible for Medicare Parts A and B. For retiree subscribers who deferred enrollment due to a federal retiree plan or the Health Exchange or CHAP VA, you have a one-time opportunity to enroll or re-enroll in a PEBB retiree health plan. And you can do that during the annual open enrollment or within 60 days of that coverage ending. Key here is that you have a one-time opportunity to do that. What else can I do? Well, as we mentioned, you can enroll in dental coverage, and understand that if you enroll, you must remain enrolled in dental for at least 2 years. Understand that you can change plans each of those years, but you must remain enrolled. In addition, any dependents you have will also be enrolled in dental if you, as the subscriber, enrolls in dental, and they will enroll in the same dental plan. If you decide to drop dental coverage, remember you can only do that if you've had dental for 2 consecutive years. And also remember that your dependents will also be removed from the dental coverage if you drop it. In addition, during open enrollment, you can attest to the premium surcharges if they apply to you. The tobacco use premium surcharge remains at $25 per month, and understand that you can attest to that surcharge at any time of the year. It does not have to be just during open enrollment. And then there is the spouse or state registered domestic partner coverage premium surcharge, which remains at $50 per month. Please note that premium surcharges do not apply to retired subscribers who are enrolled in Medicare Parts A and B. We'll talk more about this later in the presentation. So how can you make changes? Well, one of the ways is to do it online through your PEBB My account. Any changes done online must be completed by 11:59 p.m. on November 30th, 2019. Do note that some changes do require a form, and if you're making the changes online and a form is needed, the My Account program will direct you to the appropriate form that you need to fill out. If you are submitting paper forms, they must be received by the PEBB program no later than November 30th, 2019. So do not delay on submitting those forms. What if you're not planning on making any changes this year? Understand that if your medical and dental plans are still available in your area, you will just remain enrolled in your current plan if you don't make any changes. So there are times when you're not required to have to do anything. But do note that sometimes a medical plan change may be required, such as if your medical plan is no longer available in your service area, or you or an enrolled dependent becomes eligible for Medicare Parts A and B, as we have different health plans that work with Medicare than when you're not on Medicare. So where can I go to make my changes? Well, if you go to the PEBB website and go to the Retiree section, so that's hca.wa.gov/PEBB-retirees, you'll see a green button over there in the right-hand corner that says My Account. And if you click on that, it will take you right into your PEBB My Account. If you haven't registered, you have to register the first time. Once you're registered, all you have to do is log into your account, and then you can make your changes. So what are the things that I can do in the online My Account? You can change your medical and or dental plan. Do note that some medical plan changes require a form, and you can attest to your premium surcharges if you need to do that, if they apply to you. Do understand that changes made online will show a pending January 1st date. Remember, changes made during annual open enrollment become effective January 1st of the next year, and any changes made online will not display as a change until 2020. In addition, in PEBB My Account, you can view or print a statement of insurance. I think that's a good idea. You can print one in 2019 and then print another one in January, so you can compare and make sure that you are enrolled in what you wanted to be in. You can sign up for the PEBB program's email subscription service, and you can view your dependents on your account, your medical and dental plan enrollment, your premiums, and your premium surcharge attestations if they apply. So what are the changes that do require a form? The following changes cannot be made online in PEBB My Account. That would include deferring or terminating your PEBB retiree health plan enrollment, adding or removing a dependent from your medical plan, dropping dental coverage, moving to or from a Medicare Advantage plan, or moving to Medicare Supplement Plan G. There is an exception to that last one for this year. For currently enrolled subscribers in Plan F, for this year, those people will be allowed to move to Plan G right from their PEBB My Account program. We'll talk more about the changes to Plan F and Plan G in just a few minutes. If I need a form, how do I get one? Well, you have the following options. You can call 1-866-577-2793 and request the Retiree Open Enrollment Forms packet. This line is only available to currently enrolled retiree subscribers. The packet includes instructions on how to complete the annual open enrollment forms. But do realize it can take up to 7 days to get the packet to you, so please make sure you allow enough time to receive and send back the forms. Remember, we need the forms back by November 30th, 2019. Or you can go online to the PEBB website. Again, that's hca.wa.gov/PEBB-retirees. We have a forms and publications page where you can find all the forms that you need. But do understand that the open enrollment forms are available beginning November 1st, 2019. So let's take a look at the PEBB retiree medical and dental plan premiums for 2020. Understand you're going to find your premiums in your customized letter that was mailed to you with your For Your Benefits newsletter. Remember, that letter is going to show your current enrollment and monthly premiums for both 2019 and 2020, so you can see the increase or decrease, whichever it is that applies to your plan. Your letter will also let you know what other plan options are available in your area and those rates for 2020. If you want to see all of the plans and all of the premiums, you can go online to the PEBB website at hca.wa.gov/PEBB-OE. Do understand that Medicare premiums are reduced by the state-funded contribution up to the lesser of $183 or 50% of the medical plan rate. The rates you see in your customized letter already incorporate those contributions, so you don't need to subtract those. They've already been included. All right, let's take a look at the retiree dental plans for 2020. The same dental plans are available for next year as they are this year, and those include the Uniform Dental Plan, Delta Care, and Willamette Dental, and there were no changes with the dental benefits for 2020. So everything's staying the same as far as dental goes for next year. Just a quick reminder that Delta Dental of Washington administers 2 of our plans. They administered the Uniform Dental Plan, which is our preferred provider plan, and they also administered Delta Care, which is one of our managed care plans. But do note that even though Delta Dental administers both, the networks of providers are different. To make sure that the dentist you want to see is in the network you want to select, call the plans directly to find out if your dentist participates. For Uniform Dental Plan, that's 1-800-537-3406. For Delta Care, that's 1-800-650-1583. So now let's take a look at the medical plans for those who are not yet eligible for Medicare. Right? These are our non-Medicare plans. We'll talk about the Medicare options in just a few minutes. So kind of like with dental, the same plans are available for non-Medicare enrollees for 2020. PEBB offers a Kaiser Permanente Northwest program, Kaiser Permanente Washington, and the Uniform Medical Plan. While we still offer the same 3 programs, note there are some changes in service areas for 2020. We'll go over that in just a minute. So for retirees not enrolled in Medicare, Kaiser Permanente Northwest offers the Classic and their Consumer-Directed Health Plan with Health Savings Account plan. For Kaiser Permanente Washington, there's the Classic, their own high deductible with HSA plan, the Sound Choice, and the Value Network. Again, those are all the same as in 2019. With the Uniform Medical Plan for retirees not enrolled in Medicare, again, UNP offers the same plans for 2020, which include the Classic, their high deductible with Health Savings Account plan, and the 2 UNP Plus plans, which are the Puget Sound High Value Network, along with the University of Washington Medicine Accountable Care Network. So, what plans are available where you live? Well, availability does differ by plan type and your place of residence. As a reminder, there are some changes in availability for 2020. See your October For Your Benefit newsletter for more information on those changes. In addition, you can find information about plan availability in the 2020 Retiree Open Enrollment Forms packet, the 2020 Retiree Enrollment Guide, and the PEBB website on their Medical Plans Available by County webpage. The address is listed for you on the screen. availability for UMP Classic and the high deductible plan are available to subscribers who live worldwide. So anywhere in Washington State, anywhere in the nation, anywhere worldwide, you have coverage through the Uniform Medical Plan, whether you pick the Classic or the high deductible with HSA plan. The UMP Plus plans are available only in select counties in Washington State. For the Puget Sound High Value Network, those counties are King, Kitsap, Pierce, Snohomish, Thurston, and Yakima. Do note that the Puget Sound High Value Network is leaving Spokane County for 2020. The Puget Sound High Value Network is adding the following provider groups: the Polyclinic, as well as the Rainier Health Network, which includes Tri-Franciscan, City MD, Franciscan Medical Group, Northwest Physicians Network, the Doctors Clinic, Pediatrics Northwest, and Highline Medical and Primary Care Northwest. Also note that the following provider groups are leaving the Puget Sound High Value Network for 2020. They include Multicare, Evergreen Health, and Overlake Medical Center and Clinics. For the University of Washington Medicine Accountable Care Act, it is available in select counties in Washington as well. Those counties are King, Kitsap, Pierce, Skagit, Snohomish, and Thurston. Do note Spokane County is new to the UW plan for 2020. So while the Puget Sound High Value Network is leaving Spokane County, the UW ACN plan is joining Spokane for 2020. So for Spokane residents for 2020, there still will be a UMP Plus plan available. It will just be a different network. Also for the University of Washington Medicine ACN plan, the following provider groups are being removed for 2020. They include Island Hospital, as well as Overlake Medical Center and Clinics. Plan availability for Kaiser Permanente Northwest for their classic and high deductible plans. Those are available in select counties in Washington and Oregon. And for 2020, they are adding a couple zip codes in some Oregon counties. They include Clackamas County zip code 97028 and Marion County zip code 97350. The Kaiser Permanente Washington Classic, high deductible with HSA and value plans are available in select counties in Washington State. For 2020, Kaiser Permanente Washington removed these plans from the service areas in Oregon and Idaho. However, if you are currently enrolled in one of these plans and live in Oregon or Idaho, you can keep your coverage. However, Kaiser will not be enrolling new subscribers who live in Oregon and Idaho. They also removed some partial counties in Washington State. Those are Grays Harbor, Lincoln, Pend Oreille, and Stevens. But again, if you are currently enrolled in one of those three Kaiser plans, you are eligible to remain enrolled in that plan, but Kaiser Permanente Washington is not accepting new members in those plans if you live in one of those four counties. Also, for 2020, San Juan County is being removed from the service area for these three Kaiser Washington plans. But with San Juan County, if you are currently enrolled, you will still have to find a new plan for 2020. So not only will they not be accepting just new enrollees, even if you are currently enrolled and live in San Juan County, you will have to pick a new plan for 2020. For the Kaiser Permanente Washington Sound Choice plan, that plan is available in select counties in Washington, and they are King, Kitsap, Pierce, Snohomish, Spokane, and Thurston counties. As far as benefit changes for the Kaiser plans for 2020, there are no changes to the medical plans for 2020. There are a few benefit changes regarding the Uniform Medical Plan. They will be increasing the lifetime limit for nutritional visits from 3 to 12. They will offer a 24/7 medical advice through their Advice 24 nurse line at 800-267-6729. Do note that the UMP Plus UW ACN plan will keep its own nurse line, which is 855-520-9500. UMP will be removing Tier 3 from its preferred drug list. There is an exception process for members who require drugs that were on the Tier 3 and are no longer covered. Please work with your provider and the Uniform Medical Plan to work through that process. In addition, UMP added an annual $4,000 prescription drug out-of-pocket maximum for families. It is keeping the individual prescription drug out-of-pocket maximum at $2,000. UMP has also increased the medical out-of-pocket limit for a single member who's enrolled under the family plan in the Uniform Medical Plan High Deductible Plan. That amount is up to $6,900 this year, a $50 increase from 2019. The Baby-Wise Maternity Program is going to be new to help expectant mothers manage their health during pregnancy. In addition, if you're in the high deductible plan with Uniform Medical, Health Equity, which is the vendor for the health savings account, they will be issuing new debit cards in December of 2019 for members who enroll in the Uniform Medical Plan High Deductible Plan for 2020. In addition, they are going to be establishing a new phone number just for Uniform Medical Plan High Deductible Plan members. That number is 844-351-6853. If you have a high deductible plan through Kaiser, the number that you've used is remaining the same. This phone number is just new for Uniform Medical Plan enrollees. In addition, there's going to be some new pre-authorization requirements for some services with the Uniform Medical Plan. To learn more, you can go to the website at hca.wa.gov//UMP/PEBB-open-enrollment. You can also read about those changes in the UMP Open Enrollment newsletter, as you see pictured there. In addition, there's going to be a new UMP website for 2020 with a new address. The new address is going to be regents.com/UMP/PEBB. And that site is going to have information regarding 2020 information. Do note that the current site will be hosting information regarding 2019 through December of 2019. Let's talk about some reminders regarding consumer-directed health plans within HSA. So if you are enrolled in one of those, the contribution amounts that the HSA will be making for you is not changing for 2020. It remains at $700.08 per year for an individual and $1,400.04 per year for a family. But do note that the IRS maximum contribution amounts to an HSA have increased for 2020. For an individual, that new amount is going to be $3,550, a $50 increase from last year. And for a family, it's going to be $7,100, a $100 increase from last year. And still remaining, if you're age 55 or older, you can contribute an additional $1,000 per year. Do note that towards that maximum, that includes HCA contributions, your subscriber contributions, and any wellness incentives if you earned. All of those count towards that maximum contribution amount. In addition, if you or a medical eligible dependent are currently enrolled in a high deductible plan with an HSA and will be turning 65 in 2020, you should probably consider changing your plan for 2020, as contributions cannot be made to an HSA while you are in Medicare. What happens, the IRS may impose a penalty if you enrolled in a CDHP with an HSA when entitled to Medicare. Another item with a high deductible plan in Medicare, retirees may not be enrolled in both Medicare and a high deductible with a HSA account. If you are Medicare eligible, you must change your plan. Changing your plan after enrolling in medical will require the out-of-pocket maximum and annual deductible to start over, which could be costly if you have already met these limits. If any enrolled dependent enrolls in Medicare, you must change your plan or remove that dependent from your PEBB coverage. Understand that those dependents will not be eligible to enroll in PEBB continuation coverage. So let's take a look at the PEBB medical plans for those on Medicare. Understand that Medicare-eligible subscribers and dependents must enroll and stay enrolled in Medicare Parts A and B in order to enroll or remain enrolled in a PEBB retiree health plan. The PEBB program offers 3 types of Medicare plans. One is a Medicare Coordination of Benefits, or COB plan, that's provided by UMP Classic Medicare and the Kaiser Permanente Washington Original Medicare plans. We also offer 2 Medicare Advantage plans. One is through Kaiser Permanente Washington, and one is through Kaiser Permanente Northwest, which they call their Senior Advantage plan. In addition, PEBB offers a Medicare Supplement, or Medigap plan. There is Plan F, which is closing to new enrollees as of January 1st, 2020. We're going to talk more about that in just a minute, but there will be a new Plan G for 2020. What about Medicare plan availability? Again, UMP Classic Medicare is available worldwide. The Premier Blue Cross Medicare Supplement plans, F or G, are available nationwide. For Kaiser Permanente Northwest, the Senior Advantage plan is available in select counties in Southwest Washington and some select counties in the Portland, Oregon area. For Kaiser Permanente Washington, the original Medicare Coordination of Benefit plan is available in several counties in eastern Washington. Their Medicare Advantage plan is available in several counties in western Washington, but that also includes Spokane. So Spokane is the one that's a little different. Spokane does offer the Medicare Advantage plan. Do note that if you are in a Kaiser Permanente Medicare Washington Medicare Advantage plan, you will be getting a new ID card in December. Your ID number is not changing, you're just getting a new card. All right, so let's talk a little bit about what these plans provide. PEBB Medicare Advantage and COB plans provide coverage for additional services not covered by Medicare Parts A and B. They also provide prescription drug coverage, as well as vision, hearing, and alternative care. The Medicare Supplement Plan F provides the same benefits as Medicare Parts A and B, but it also pays 100% of the Part B coinsurance charges, as well as the Part A and B deductibles, and also provides for foreign travel emergencies. Plan F does not provide prescription drug coverage, routine vision or hearing, or alternative care. Just a reminder, Plan F is not going to be available to new enrollees in 2020. New for 2020 will be Plan G. Understand, it basically covers the same things as Plan F, except Plan G does not cover the Part B deductible. So that's the one change between Plan F and Plan G. Otherwise, Plan G works the same way as Plan F. So let's talk about Medicare and Part D. Part D is a prescription drug plan. Understand, you don't need that if you enroll in a Kaiser Permanente Northwest Senior Advantage, Kaiser Permanente Washington Advantage or Original Medicare plan, or the UMP Medicare Classic. If you enroll in any one of those plans, you do not and should not be enrolling in a Part D prescription drug plan. All of those plans include prescription drug coverage, which is considered credible coverage by Medicare. And if you do enroll in Part D while you're enrolled in one of these plans, PEBB is going to require that you either drop that Medicare Part D or you change to the Medicare Supplement plan that we offer, Plan G. Understand that neither Medicare Supplement Plan F nor G provide prescription drug coverage. So then you would want to go out and look for that coverage for yourself, which you could get through other credible drug coverage, such as the VA, or you can purchase a Medicare Part D plan through a private insurance company. Do note that PEBB does not offer a Medicare Part D plan. If you don't enroll in a Part D drug plan when you were first eligible, you may have to pay a late enrollment penalty if you enroll at a later time and did not have credible coverage. And remember, PEBB does not offer a Medicare Part D plan. To find more information on PEBB medical plans with Medicare, please go to the PEBB website, and there's a webpage on Medicare and PEBB program benefits. Medicare plan changes for 2020 are basically with the Premera Blue Cross Medicare Supplement Plan F. As a reminder, it will not be accepting new members as of January 1st, 2020. PEBB will be offering Plan G for new members as of 2020. For questions about Plan G, we suggest that you contact Premera Blue Cross at 1-800-817-3049. There are a couple nuances that you should be aware of if you are in Plan F. If you, the retiree, are enrolled in Plan F as of December 31st, 2019, and you want to stay in Plan F, you can do that. You do not have to submit any forms. Coverage will just continue automatically. So if it's just you and you're already in F and you want to stay on Plan F, you can remain enrolled. Remember, Plan F is simply not accepting new enrollees. Understand, though, that if you defer or terminate your PEBB coverage, you will not be allowed to re-enroll in Plan F in the future. Also, if an enrolled dependent becomes eligible for Medicare on or after January 1st, 2020, you're going to have to do one of the following. Either change your medical plan from Plan F to enroll your dependent, or you would need to remove your dependent from coverage if you wish to stay enrolled in Plan F. Understand, if you remove your dependent, they will not be eligible for PEBB continuation coverage. What if your dependent is enrolled in Plan F currently and you, the retiree, becomes eligible for Medicare on or after January 1st, 2020? You will have to change to another PEBB medical plan for both you and your dependent. The dependent will not be able to remain enrolled in Plan F once you become eligible for Medicare. For questions about making a plan change, you can call the PEBB program at 800-200-1004 and select option 6. Okay, let's talk about the PEBB premium surcharge attestations. First is the tobacco use premium surcharge. Remember that non-Medicare retiree subscribers only need to attest to this when you or a dependent has a change in your tobacco status, or you enroll a dependent age 13 or older in PEBB Medical. You can visit the PEBB website to find the 2020 premium attestation surcharge change form, and also to find out what is considered to be tobacco use. Do note that the tobacco use premium surcharge does not apply to retired subscribers who are enrolled in both Medicare Parts A and B. For the spouse or state-registered domestic partner coverage premium surcharge, you will need to attest to this surcharge if you are a non-Medicare retiree subscriber and you are enrolling your spouse or state-registered domestic partner in PEBB Medical for 2020. You may need to attest the surcharge if you are a non-Medicare retiree subscriber who attested in 2019 and will be keeping your spouse or state-registered domestic partner enrolled for 2020. Understand that we're going to mail you a notification letter in late October, which includes the premium surcharge help sheet and the change form. And lastly, again, the spouse or state-registered domestic partner premium surcharge does not apply to retired subscribers enrolled in both Medicare Parts A and B. You can attest or reattest during the PEBB program's annual open enrollment. You can do it online through PEBB My Account. Remember, those have to be completed by 11:59 on November 30th. Or you can submit the change form, again, to the PEBB program, but we must receive it no later than November 30th. If you are required to attest, but you don't within the deadline, you will be defaulted to incur the $50 monthly premium surcharge, which is in addition to your medical premium. It will be effective January 1st for 2020 and remain in effect for the rest of the year. Your next opportunity to attest would be if a special open enrollment event occurs, and you can go to the PEBB website to find a listing of all the different types of special open enrollment events and what changes may be allowed. You can also attest no later than 60 days after your spouse or state-registered domestic partner's employer-based group medical status changes. or you could reattest during the next annual open enrollment. If you feel that you should not be having to pay the surcharge, you can appeal through the appeals process, which you can find at the PEBB website. Let's take a look at the SmartHealth Wellness Program for 2020. A reminder that only subscribers can qualify to earn the wellness incentive. And those incentives they remain the same for 2020, which includes a $125 reduction in your retiree's medical deductible, or a one-time deposit of $125 into a health savings account if you are enrolled in a high-deductible plan. Also for 2020 is the $25 Amazon.com gift card. Do understand that spouses or state-registered domestic partners that are enrolled in PEBB Medical can participate through the SmartHealth website, but they are not eligible for the financial wellness incentives. Only the main subscriber is eligible. And subscribers enrolled in both Medicare Parts A and B are not eligible to join SmartHealth or qualify for its rewards. There are some new incentive deadlines for 2020 with SmartHealth. For subscribers who are continuing enrollment in PEBB Medical or enrolling with an effective date between January and September 2020, your new incentive deadline to hit your 2,000 points is November 30th of 2020. For subscribers who enroll later in the year from October through December, they will have until December 31st, 2020 to meet their deadlines. To learn more about SmartHealth, you can visit the website at smarthealth.hca.wa.gov. So last couple of things here. Let's talk about who you should contact when you have different questions. You should be contacting your health plan when you want to find out how your health plan works or how claims are processed, what prescriptions are or not covered, what healthcare providers are part of your plan's network. Phone numbers for your health plan can be found in your newsletter, your ID card, the enrollment guide, or at the PEBB website. For questions about Medicare, please call 800-633-4227. For questions about Medicare enrollment, please call the Social Security Administration at 1-800-772-1213. Reminder, PEBB does not enroll you in Medicare. For questions about PEBB retiree insurance, such as eligibility or enrollment, the monthly rates, or questions on your account, you can call our customer service at 800-200-1004. Thank you for watching this presentation on the 2020 PEBB Program Annual Open Enrollment Period.